Hello, I'm here to tell you about the 2020 Ucare Medicare Group Plan available to Education Minnesota retirees and their spouses. Let me tell you a little bit about Ucare. We provide health care coverage to more than 100,000 Minnesotans on Medicare. In fact, 96% of our Medicare members stay with us year after year. We've been offering Medicare Advantage plans for more than 20 years here in Minnesota, and we were the first Medicare Advantage plan in the marketplace. We offer friendly customer service with a real person located right in Northeast Minneapolis. One of the advantages of a Ucare Medicare plan is that we have 96% of Minnesota providers within our network. We partner with entire health systems, including Allina Health, mHealth Fairview, Park Nicollet, North Memorial Health, Stillwater Medical Group, Ridgefield Clinics, and the Mayo Clinic is also within our network. There are no referrals that you need to see a specialist in any of these networks. Some additional advantages of the Ucare Medicare group plans is our large service area that includes Minnesota and 26 counties in western Wisconsin. Also, as I had mentioned, that local customer service. We have a lot of members and folks considering our plans stop by our offices in Northeast Minneapolis. We have rooms available for folks to walk in and ask their questions about Medicare and their health plan. Also, our plans include lots of extras, perks to being a member that I'll talk about in our presentation. Who can join the Ucare Medicare group plan? Retirees and spouses who have Medicare Part A and Part B, continue to pay that Part B premium, live in Minnesota or within 26 counties in Wisconsin, and do not have end-stage renal disease. The reason we ask that question is because there's a special Medicare plan for those that do have end-stage renal disease, and that plan would be a better fit for this person. You have a choice of 3 plans under the Ucare Medicare group rates. The high plan at $342 per month is a good plan for someone who's a high user of health care and may be taking expensive prescription drugs. It has the lowest co-payments and the best prescription drug coverage. On the other hand, the basic plan is a good plan for those that are looking for a low premium and aren't very high users of health care. They're comfortable paying higher co-pays. This plan also does include prescription drug benefits. The core plan is a plan that's right in the middle, and in fact it happens to be our most popular plan. It has lower co-payments than basic does, but it doesn't have the high price of the high plan, and that's a good plan for someone who's looking for coverage that's kind of in the middle of the road. I should note that you can choose amongst these plans at every open enrollment each year, and that spouses needn't be on the same kind of plan. These are the benefits that are in all 3 of our Medicare group plans. Preventive services are covered at 100%. That includes your annual physical and routine tests like mammograms and colonoscopies. All of our plans also include preventive dental. You'll have coverage for cleanings, exams, and x-rays, which I'll talk about later. All 3 plans include prescription drug coverage with Medicare Part D, which I'll also go into later. Each of our plans has a medical out-of-pocket maximum of $3,400. What that means is when you, out of your payments from your checkbook, add up to $3,400 in a single calendar year, then you are now covered at 100% and you'll pay no more co-pays and co-insurance for the rest of the year. While on the Ucare Group Medicare plan, you do need to choose a primary care clinic. Keep in mind that this is just a home base, and you can change your clinic anytime. We just think that you should have a doctor that knows you. On all 3 plans, a primary office visit is a $15 copay. Here is where the 3 plans start to differ. You can see any specialist in our network and no referral is needed. As I had mentioned, your primary care clinic is just a home base. You do not need to go through that doctor or that clinic to make an appointment with any specialist you would like to see. Simply find that specialist using our Find a Doctor tool at ucare.org or call us. A specialist office visit continues to be a $15 copay on the high plan, but if you're on core, that is now a $30 copay, and basic is a $40 copay to see a specialist. Let's say that you're admitted to the hospital while on our plan. That will be covered at 100% after a copay. On the high plan, that copay is $100 for the entire time you're in the hospital. On the core plan, that copay is $200, also for the entire time you're in the hospital. The basic plan is a little different. That has a $300 copay per day for the first 5 days before coverage kicks in at 100%. Keep in mind that $300 for a day in the hospital is in fact a benefit, but you will pay more for hospitalization on the basic plan than you would on the high and core plans. While you're in the hospital, you'll be visited by countless providers. We will coordinate all of that paperwork on the back end as to who gets paid and how much and when, so you can just focus on getting better and going home. Let's say here that you're going to have some cataract surgery. Well, that's outpatient surgery and it's covered at these copays. High has a $200 copay and core and basic have a $250 copay. Now let's say that you've been hospitalized for that knee surgery, but you're going to be going into some rehab after that. Well, skilled nursing and rehab is available to you without the 3-day inpatient hospital stay requirement that other plans may have. So yes, you can go immediately into rehabilitation from surgery, either inpatient or outpatient, without having to be in the hospital for 3 days for that to be covered. When that does happen, you pay nothing for days 1 through 20 for that rehabilitation services. If you have to stay more than 20 days, then it's $100 per day for days 21 through day 100. The most often asked question of all the retirees I speak with is, am I covered when I travel? And the short answer is yes. Ucare Anywhere travels with you anywhere in the U.S. You pay the same co-pays to see a doctor in Minnesota as you do to see a doctor in Florida or California or Arizona, so long as they accept Medicare patients. So that copay of a $15 copay to see a doctor in Minnesota, same $15 to see a primary doctor in those outside of Minnesota as well. You also have coverage for emergency services worldwide. You pay just the emergency room copay. If you are injured outside of the U.S., you may need to pay for it yourself and then get some kind of receipt. We will reimburse you everything less the copayment. You can also be a snowbird. You can travel out of the service area for up to 6 consecutive months, and you don't need to notify us of your comings and goings. The plans also have some vision and hearing benefits. On the high and core plans, you can get a diagnostic vision exam and pay nothing. Also on high and core, there's a $150 eyewear reimbursement each year. Get your glasses anywhere, submit to us a paid receipt, and we'll reimburse you up to $150 each year. Also, there's a diagnostic hearing exam that is at no copayment when you're on the high and core plan as well. Those vision exams and hearing exams are considered specialist appointments on the basic plan, so you do pay $40 for those appointments. New this year is a great hearing aid benefit. Go through True Hearing and you're eligible to get a hearing aid for either $699 for an advanced hearing aid or $999 for a premium hearing aid. And you get 2 hearing aids per year. All 3 plans have this hearing aid benefit. Also new for 2020, each member gets $25 each quarter to spend on over-the-counter medicines, over-the-counter products, things that you would get around the pharmacy counter. You'll get information about that when you become a member. Another nice thing about the Ucare Medicare group plans are the dental benefits. Preventive dental is included in your plan at no extra premium. Each year you get 3 cleanings, 2 exams, and x-rays at no additional cost. If you do need coverage for things like fillings, crowns, dentures, things of that nature, then you can add the additional dental coverage for $22 per month. The plan has a $50 deductible and it pays up to $1,200 out to you in benefit. As I had mentioned previously, all 3 of our plans include prescription drug coverage with Medicare Part D. Our formulary is our list of covered drugs. Each of the drugs on our formulary are under a specific tier. We have 4 tiers of drug coverage: generic, preferred brand, non-preferred, and specialty. Ucare has a large pharmacy network and mail order available through Express Scripts. Within that large pharmacy network, we have preferred pharmacies. When you fill your drug at a preferred pharmacy on a group plan, you get a 90-day supply for 2 copays. Preferred pharmacies include Walmart, Sam's Club, Cub, Costco, CVS, and many more. You can look online to see which pharmacies are preferred pharmacies within our network. Here's how Ucare covers drugs. After you've looked up your drugs and learned what tier they fall under, you could be subject to the deductible or not. You notice the asterisks after the $100 deductible for high, $200 deductible for core, and that $400 deductible for basic. If you've looked up your drugs and learned that they're all under Tier 1, then you are not subject to paying those deductible amounts at the beginning of the year. Only those folks who have drugs in Tier 2, 3, or 4 will be subject to that deductible before they start paying these low co-payments. You pay these costs up until and unless your drug cost reaches $4,020 in the year 2020. If that happens, then you have fallen into the donut hole, the prescription drug gap, which we'll talk about next. Here is how we cover drugs if you do in fact fall into the coverage gap stage and you're in the donut hole. On the high plan, you have unlimited drug coverage. You'll continue to pay the same co-pays as you always have been all the way through the donut hole. On the core plan, we'll cover you the same for those Tier 1 generics that you're paying $12 for a 30-day supply for. Those will continue to be $12 while you're in the gap, but you will change and start paying 25% of the cost of your brand name drugs. If you're on the basic plan, you will pay 25% of the drugs in both the generic and brand name categories while you're in that prescription donut hole. You will pay these costs until you reach $6,350 in out-of-pocket costs. Note that this is not simply a subtraction of $6,350 from $4,020. That money in the $6,350 bucket is only money that you have spent out of your own pocket. It does not include money that the insurance company has spent. If that should happen and you reach this catastrophic coverage level, then you'll pay a low copay or 5% coinsurance for the rest of the year, whichever is greater. Remember when I mentioned that Ucare has perks to being a member? Well, one of the very best perks is this Silver Sneakers benefit. You get a free fitness membership at all of the Silver Sneakers locations throughout the United States. You can go to any of them. You simply go to silversneakers.com, look up gyms that are in your area. You can use it while traveling. Look up gyms that are in Florida or California, wherever you may be going, and you can go to those gyms and pay nothing. Let's say you go to a gym that's not in Silver Sneakers. Well, we have another list of participating health clubs that are offering a health club savings. So instead of getting the free membership, you get a reimbursement check of up to $20 towards your monthly Health Club membership fees. On either of these two plans, there is no minimum number of times you have to go to the club. You can go every day, you cannot go at all. These are still options available to you. Additionally, there's a Minnesota Community Education discount. You can get up to $15 off on 3 community education classes each year. How do you join the Ucare Medicare group plan? It's easy. Retirees and spouses may enroll when they're Medicare eligible, generally at age 65. Each retiree and spouse fills out their own application form and plan choice form. Keep in mind, spouses don't need to choose the same plan choice. You simply pick up an enrollment folder that's available at the meetings, or you can call us to request one. Each enrollment folder has 2 applications and 2 plan choice forms for you each to use. Inside the folder is a bright green envelope that is postage paid for you to send those application forms to us. Welcome to Ucare. Once you become a member, you will receive a confirmation of enrollment letter in the mail. After that, a member ID and new member packet should come. You'll have access to our customer service and to our 24-hour, 7-day-a-week nurse line. Depending on your claims, you may be contacted by one of our disease management programs to monitor things like heart disease, diabetes, with interesting treatments. You're also eligible to join the member portal at ucare.org so that you can see your claims and look at the history that you've had with Ucare. Do you have questions about the Ucare Medicare group plan, or would you like to learn more? Please contact us by phone at 612-676-6900 or at our toll-free number. You can also email us at groupsales@ucare.org. If you'd like to come in and visit with us about your specific Medicare questions, please visit our offices at 500 Stinson Boulevard in Minneapolis. We're happy to see you. Thank you so much for listening to this presentation on the 2020 Ucare Medicare Group Plan. Happy retirement!